Welcome to Adapt NCLEX, and thank you for deciding to watch this video. Let's do some content mastering using questions on respiratory NCLEX practice. This is a respiratory topic. These are concepts you have to know. I put a few of them together to just show you some of the things when you're studying you should focus on. Before that, Adapt NCLEX has a bunch of resources that you can use to master your content to pass your NCLEX. I guarantee you, if you join our membership, you'll be surprised how much content you're going to master and take the NCLEX with confidence. First question, select or apply. Which client intervention the nurse should question? A nurse is providing care for several clients experiencing acute exacerbation of asthma. Keyword, buzzword, experiencing acute exacerbation of asthma. Which client intervention the nurse should question? So which one you should question? Select or apply. Buzzword, acute asthma. What do you think? Something acute, we got to solve it right away. We should pick a medication that is fast acting. That will take care of the medication quickly, the problem quickly. A client prescribed what? Montelukast. Do you use this for acute asthma exacerbation? Does it work like acute problem? The main thing you have to know is you want a bronchodilator that is going to act fast. You want anti-inflammatory that is going to act fast. Montelukast, metaprednisolone, right? Ipratropium, Salmeterol, Salbutamol, Albuterol. Think about it. Montelukast is for long-term treatment. You cannot use for acute flare, right? Therefore, which one you should intervene? This one. Methylprednisolone can be used for acute flare. Therefore, you don't need to intervene. Ipratropium is an anticholinergic, act as a beta block. Anticholinergic is used in acute flare. Salmeterol is a long-acting, so for maintenance, right? You cannot use it for acute flare. Salbutamol, look at it carefully. This is the same as Albuterol. That's another name for Albuterol. It's not Salmeterol, it's Salbutamol, right? This is Albuterol. You can use it for acute flare, so you don't need to intervene. Albuterol is also a form of Albuterol. You will use it in acute attack. So which client intervention the nurse should question? Which one you should not use it in acute situation? I'll question it. Montelukast, right? I won't question steroid. I won't question anticholinergic. I will question Salmeterol. I won't question Salbutamol, which is Albuterol. I will not question Albuterol. Those are all used in acute situation. And therefore, we're looking for medication that cannot be used in acute situation. That's when you will intervene for that situation. Okay, so that's the right answer. And then provide care for a client with COPD prescribed Ipratropium bromide, which finding the nurse should observe as therapeutic effect of the prescription. Same thing, go for the buzzword. They want you to look for therapeutic effect, right? What is that? Ipratropium. What is Ipratropium? This should give you an idea. It's a COPD patient. What is their problem? Worry about bronchoconstriction or something like that. So this has to be a bronchodilator. Ipratropium. If it's a bronchodilator and I give it to you, what? You're going to breathe better. You're going to feel much better. At the same time, you have to know what's Ipratropium. It's an anticholinergic, right? If I give it to you, xerostomia is the dry mouth. It's not therapeutic effect. It's a side effect. Constipation is a side effect of anticholinergic. Mydriasis, dilation of your pupil, is a complication of anticholinergic. Decreased oxygen demand. That means you're not requiring more oxygen, right? That is decreased oxygen demand. That means you do much better. You don't even need oxygen because I give you Ipratropium. So this is a therapeutic effect. That's taking strategy, content mastering, Adapt NCLEX way. Number 3, respiratory. Respiratory questions require a lot of content and thinking. Which statement by the client indicate the need for further teaching? They're saying something bad, need further teaching. And let's provide teaching to a client with asthma prescribed what? Fluticasone, Salmeterol. It's called Advil due to recent flare. Look at it. You have a steroid and a long-acting medication. Therefore, look at the answer choice and whether it's consistent with that and asthma, right? I will avoid tobacco products. Of course, you have COPD, you have asthma, you should avoid tobacco. You don't need it. Further teaching. I will ensure my vaccination is up to date. I don't want you to get sick. Get your vaccination. I will take this medication the first sign of attack. This is not used as a rescuer because of the long acting. You want a fast acting medication like Albuterol. I will rinse my mouth after using the medication. It's because of the story to prevent candidiasis. Therefore, number 3, need intervention. Number 4, a client with a history of asthma presents to the emergency department anxious, audible wheezing, saturation 85, and tachypnea. After oxygen therapy via non-rebreather, which prescription the nurse should anticipate? Test taking strategy, a bunch of words. Forget about it. Asthma patient is the buzzword. Anxious, audible wheezing, saturation is tachypnea. Write all of them and say what? Acute exacerbation. If you have acute exacerbation, we give you non-rebreather, we give you oxygen. Now, why are you wheezing? It's because there's bronchoconstriction, either involving the muscle around the airway or inside. Then there's inflammation. You cannot take care of the inflammation unless you open the airway. The first medication you can give is a beta-2 agonist, but you need a fast acting. Which one is the fast acting? Propranolol is a what? What do you think? It's a beta block, right? It's a beta-1, beta-2 blocker. Non-selective. It's going to block your asthma patient should avoid, should be okay with the balm, bisoprolol, atenolol, and metoprolol. Propranolol is a non-selective beta blocker. It's going to block the beta-2 receptors on the asthma patient, and it causes bronchospasm. Don't use it. Salbutamol, this is Albuterol. It's used for fast acting. It's a beta-2 agonist. This is fast. It causes bronchodilation. Salmeterol is also beta-2 agonist, but it's a long acting. It will take you a long time. Atenolol is selective, right? It will just block beta-1. We want something that will dilate, not block. Therefore, Salbutamol is your right answer. Test taking strategy. Okay, really hard question, but 2 is your right answer. Number 3, a nurse is aware of all client at change of shift. Which client the nurse should see first? Prioritization. You got to be sharp. If you don't know, be sharp. Check Adam Thinkers. 3 videos about prioritization. This is your key for prioritization. I bet you'll see how your score will go up, or your grade when you are nursing school, LPN, whatever. Be sharp is your key. It's just a strategy, thinking wisely and being sharp, right? And not expected. Cystic fibrosis, what do you expect in them? What do you think is going to happen? What do you think you should focus on? Somebody with cystic fibrosis, right? What do you think? If I give you acetylcysteine, right? And then you have what? Increased lung capacity, increased vital capacity, increased dead space after acetylcysteine, increased lung volume. This requires you to know the definition of each individual lung findings. What is total lung capacity? First of all, what is total lung volume? Lung volume is like usually amount of air you inspire in and out, right? If I give you acetylcysteine, now you can take in more out of air in, right? If I give you your vital capacity is also involved the total amount of air in the lung at the end of vital, end of forced inspiration. After you take a lot of force, taking a large amount of air with the force, the amount of air that comes out, right? Vital capacity. Total lung capacity is also basically the how much you can take in using the force inspiration. So these are all part of it, right? Look at it. Dead space is a problem. If you increase your dead space are areas where there is no oxygen going there. Therefore, if you increase your dead space, this is dead. And this is where you can do exchange. This is bad. You should not be, you should decrease your dead space, right? And then you should increase your total volume of your lung, right? Amount of air inspire and expire in the single breath. Then your vital total lung capacity is the total volume of air accumulated in the lung at the end of forced expiration. And the vital capacity is basically the maximum amount of air that can be expelled after a maximum inspiration and expiration. Dead space is what is left that doesn't involve in exchange. Therefore, number 3 is the patient that you need to see. Their dead space is increased. That means there's so many, the acetylcysteine is not working. You have a bunch of mucus blocking, causing athleticis. So 3 is the right answer. Number 5. A nurse is aware of 4 clients at change of shift in the emergency room. Which client the nurse should see first? Client with what? You have backing cough, saturation 95, rheumatic, runny nose. What do you think this is? Purulent nasal discharge, sore throat, and that. What do you think this is? I have dysphonia, dysphagia, and drooling. What do you think this is? Whooping cough, severe sneezing, and nasal congestion. What do you think it is? Pertussis, croup, that's a sore throat, and epiglottitis. Which one is more dangerous? Epiglottitis. Is content with the buzzword. Number 3 is your right answer. And this is providing care for 4 clients in emergency in the ICU receiving mechanical ventilation with positive and expiratory pressure of 15, right? Which clients need immediate follow-up. All I'm saying is 4 patients intubated, getting PEEP, and a PEEP of 15. PEEP of 15 is too high. Like we try to be 1 to 5, 0 to 5, and sometimes we can go up to 10. After 10, PEEP can cause problem. When you have PEEP in your chest, it's going to cause intrathoracic pressure. And therefore, intrathoracic pressure, when it's increased, it decreases what? Venous return. In the process, causes hypotension, blood pressure go down. It can also cause barotrauma. You get pneumothorax. Those are the 2 things you should not forget. Therefore, this client has a blood pressure of that. It's no problem. Subcutaneous emphysema is bad. It's an indication of pneumothorax. PaO2 of 86. Normal PaO2 is 80 to 100, right? When you give somebody PEEP, you're improving their oxygenation. This patient is oxygenating well. PCO2 of 48, it tells you they're not ventilating, but PEEP does not help with that. 48 is not bad, but they're not ventilating well. PEEP does not improve that. We are looking for some problem with PEEP. Subcutaneous emphysema is pneumothorax, and that's a problem. You need immediate follow-up on that. And this is providing care for 4 clients with chest tube connected to closed chest drainage system after thoracotomy. They all have chest tube, right? Which client situation need immediate follow-up? You have to know chest tube and its function and what you should expect in each 6 and chambers. Continuous bubbling in the suction chamber. Yes, I'm bringing suction in it. As you see, continuous bubbling. Intermittent bubbling in the water seal. Yes, you get small intermittent bubbling. It's not continuous, it's intermittent in the water seal. That's fine. No fluctuation of fluid column in the water seal. If this is the chest tube connected to the patient, there should be fluid column moving up and down or fluid column going up and down. This is what we call tidling. There's no tidling. You got to make sure patient is breathing. That's the first thing you check. This is a big problem. Blood thin fluid in the collection chamber. Yes, it's going to collect fluid. It looked like Kool-Aid. That's not a problem. Number 3 is your right answer. And then provide care for a client with COPD who need precise oxygen delivery device. Which oxygen delivery device the nurse should anticipate to be prescribed? Read the question from the back. Read the question from the back. Read the question from the back. Which oxygen delivery device the nurse should anticipate to be prescribed, and then prescribe it. Provide care for a client with COPD who need precise, the question is a precise oxygen delivery device. That means it has to be precise. If I'm giving you 21%, I'm giving you exact amount. The best device that can do that is Venturi mask. So we use it on COPD patient if they need precise oxygen oxygen delivery. So 3 is your right answer. And the last one, like I told you, content mastering, you have to know this and then you can use it. But this is respiratory content. If you need some, check out that class or join us every Wednesday and Sunday, Saturday to learn some content. And nurse is providing teaching for a client with chronic bronchitis. Which of the following information the nurse should include in the teaching? Select or apply. Go for the buzzword. Select or apply. Don't select everything if you don't know. Pick those you're confident. Don't over-select. Chronic bronchitis, right? Chronic bronchitis. It's a form of COPD. What is the problem? Take mucus secretion. That's all. And that causes recurrent infection. The treatment, get rid of the secretion as much as possible. So hydration will dilute it, right? Pursed lip will not take care of your secretion. This is used for emphysema to prevent hair trapping. Frequent rest, good. Humidify your hair so that it can easy to pass, right? Acetylcysteine will break down the mucus. Of cough, yes, cough the mucus out. So 1, 3, 4, 5, and 6 are your right answer. This is Adapting Class. Thank you for watching. Once again, join our on demand. If you want to learn, you have a Q bank, you can watch and play and do cases study. And then all the content is in a simplified form in the video that you can watch with a bunch of quizzes, or join the YouTube membership. You get a bunch of videos. The NGN Gold will give you every video on over 600 videos, every content you want. And then you can join us on Wednesdays, 5 p.m. Eastern Time for content mastering on YouTube, or on the Zoom. I put the link there already on Saturdays at 3 p.m. Eastern Time. Take care of yourself and never stop charging. As usual, thank you for watching. Bye.